Good morning, everyone, and welcome to today's acting webinar titled as Wellbeing as a Driver for Behavioral Change. My name is Vasia Madesi, and I'm a consultant on gender equality at Yellow Window. I'm very happy to be here with you on behalf of the acting project team, and thank you all for joining us. For those who are less familiar with our work at acting, ACCTING is an Horizon 2020 funded project that brings together research and action to foster a just and inclusive Green Deal. We're coming towards the end of the project, and today's session is part of our series of thematic webinars that aim to translate ACCTING findings into concrete recommendations and practical tools for policy and practice. So we're gathering here today to explore how well-being, often seen as a personal or emotional concept, can actually serve as a driver for broader environmental and social transformation. So from sustainable food practices in schools to community gardens and active mobility, we'll hear today how placing well-being at the center of local initiatives has inspired real behavioral change in diverse contexts. So we're especially pleased to welcome participants from different sectors: civil society, education, urban planning, and more. And we'll start with a short presentation on the relevant acting fact sheet with Professor Dilay Chalabi. And then we'll move on Art Kermans from Yellow Window that will present us the better stories in the acting fact sheet from Prague and London, and will demonstrate how being-led approaches can foster long-term behavioral shifts. And we will finally have a discussion with Elina Moretopoulou from Mamagea, which is an environmental organization in Thessaloniki, and they have organized the Food for Schools initiative, which promotes sustainable food environments through participatory processes in local schools. Then we will have some time for questions and answers from your side. I want also to state that today's webinar is being recorded. No interventions from participants will be included in the final recording, so feel free to write any questions in the chat, or because we are a small crowd, or raise your hand, and this will be removed from the final recording during the Q&A session. Thank you so much. And without further ado, I will hand the floor to Professor Dilay Chalabi, Senior Researcher at CERC, and acting researcher, who will briefly present some of the key insights from the fact sheet, well-being as a trigger for behavioral change. I will stop sharing my screen.
Thank you very much, Vasia. I will share my screen. Of course, you can see it now. Okay. Good morning, everyone. I'm delighted to share insights from the acting project on how personal and community well-being can become a driver for greener and a more equal lifestyle. We'll see why well-being is a universal motivator and how it links directly to transport, food, and nature. And crucially, what gets in the way and what policymakers can do about it. So most of us, we don't wake up thinking, oh, I must cut carbon today. So instead, we want to feel better, fitter, less stressed, more connected with others. So we all act for self-interest before some abstract ideals. So if riding a bike drops my blood pressure and lets me to say hello to the neighbors, I will likely to do it again, and the carbon saving will be just a happy byproduct of that. So acting evidence also shows that, well, the coupling climate actions to visible near-term well-being rewards turns should do's into want to do's and makes habits stick for good. So that stickiness is essential for a deep, lasting, and behavioral change. So when millions of small, healthy habits add up, they directly advance Green Deal objectives into climate pollution or equality. So let me ground this in the project itself. So in ACCTING, we analyzed over 50 real-life cases, and we ran 10 hands-on pilots. So we focused on 8 different interdisciplinary thematic research lines, and consistently we saw a reinforcing loop that healthier individual choices build community resilience and social cohesion. So, but still, some systematic barriers still keep coming up. So, which are the financial constraints, the limited infrastructure, or the cultural mismatch and the plain lack of information. So, the rest of the talk tackles both the potential in this issue and those barriers in the adoption. So, our first finding from ACCTING's research line, it comes from the ACCTING's research line 6, which examined the values behind environmentally sustainable food consumption. So the pattern is clear. When budgets are tight, shoppers rank price first and end up eating fewer plant-based or locally produced foods, even if they'd like to do otherwise. On the other hand, middle and higher income households can afford to consider ethics, such as animal welfare or social justice or climate impact, and they're freer to choose what to buy. The split isn't just an ACCTING observation. So previous research also confirmed that, well, most pro-environmental behaviors, which is from buying organic to cutting meat in the diets, they cluster mainly in the higher income groups. So in plain terms, the greener diet often carries a price premium. So the lesson is clear. If we want healthier, sustainable diets to scale equally, we must lower the economic barriers. This can be through subsidies, tax cuts, or targeted food access programs, whatever, so that low-income communities are not priced out of the green choices. Our second key finding shows that when people also participate in bottom-up initiatives like community gardens, zero-waste groups, or local climate campaigns, their personal food compass also swings dramatically. So first, their values change. Health benefits and the environmental or animal welfare impact of what's on the plate suddenly matters far more. That internal shift shows up also in the behavior. Participants tell us that they are eating plant-based or seasonal dishes more often, choosing produce that is local and organic, and crucially spending their food budget with farmers market, cooperatives, or neighborhood producers rather than some supermarket chains. And it isn't just the eco-minded people join these movements, taking part in the movement itself reshapes the everyday choices. So activism becomes a feedback loop that locks in healthier, lower impact diets long after the workshop or the protest, whatever ends. And let's also have a look at the transport to a well-being lens. So ACCTING's research lines 7 and 8 show that swapping to a few motorized trips to walking or cycling can cut stress, boost fitness, and spark day-to-day social contact. So those gains matter to everyone, but they're especially valuable for low-income families, older adults, or migrants who often have limited access to recreational space or healthcare. So ironically, the populations who would profit the most are the ones most impacted by transport poverty. So picture a neighborhood with some limited bus service, no protected bike lanes or streets with lights that flickers out after it gets dark. So residents may want to walk or cycle, but the infrastructure barriers will block them. So unsafe or non-existing infrastructure, the price of a reliable bike, of a transit pass, and very real fears about traffic or harassment. So these challenges are sharpest in the regions where public transport systems and cycling networks lag behind national averages. So based on these evidences and findings from ACCTING, we collected a list of recommendations. So the first one is integrating well-being metrics into policy frameworks. So up to now, many disciplines still judge success by traffic flow or tons of carbon dioxide alone. The previous research shows that we can do better by integrating well-being indicators directly into those policy frameworks. So, well, take an urban mobility plan, for example. Beyond counting on buses and the bikes, the plan can track reductions in the, for example, cardiovascular diseases, stress-related illnesses, or bumps in daily physical activity levels. So you may also, and another example, look at how to an environmental program. Along with the emission cuts, it can record gains through community cohesion and emotional resilience, such as did neighbors meet more often or do they feel safer outside? So why would that matter? Because when well-being sits on the same dashboard as climate targets, the decision makers can see the full payoff of a bike lane. So it makes cross-department budgeting also easier and give politicians a tangible health story to tell to their voters as well. And the next recommendation turns well-being into a design brief for city streets. First, we need the hardware. We can take the analogy of from the computer science. The hardware is the continuous footpaths, protected by cycling lanes, and the public transport that is reliable and affordable. When those networks feel safe, people walk or cycle more, and the payoffs are immediate. So blood pressure drops, fitness climbs, and casual chats with the streets strengthen the community bonds. But concrete alone, the hardware alone, won't shift the habits. So we need to support the software also. So we need to come up with programs that make active travel easy and fun. Think of bike sharing dogs, for example, every few blocks, neighborhood walking clubs, or workplace, leave the car at home kind of challenges that spotlight the stress reduction and step count bragging way. So inclusion here, but it is non-negotiable. So routes and the services have to work for grandparents, shift workers, single parents pushing their strollers, or all vulnerabilities we can consider. Low-income passengers also, some infrastructure for the benches for resting, which my mother always has problems. She cannot walk, for example, for long distances. She needs some benches on the path for resting whenever she needs to walk. Well-lit crossings and cargo bike hire for caregivers. All they widen the circle of who can benefit from these interventions. And finally, smart tools like mobility apps can pop up in the mid-journey to say, well, you have burned 120 calories. We all more or less have such software on our mobile phones. And you avoided, on the top of it, if we say, 300 grams of carbon dioxide so far. Oh, that's great. It gives me an additional motivation for that. So personalized feedback taps into some instructive motivation and then nudges the repeating behavior. So also, we need to foster the cross-sectional collaboration because the great ideas, they die in silos. So to make well-being-centered sustainability stake, we need to mobility engineers talking to public health teams, social welfare officers sitting with environmental planners and community voices all in the same room. So we need to first break the silos. We need to build a single planning table where experts on transport, healthcare, social equity, and environment share data and their budgets. And we need to bundle the policies. If we launch a new cycle lane for a network, we need to pair it with a health promotion campaign that prescribes back to work weeks and free safety training. So citizens see one seamless intervention, not two government bodies talking in different structures. And we need to also establish permanent multi-stakeholder platforms. So these, for example, can be quarterly forums where city officials, employers, NGOs, and other residence groups co-design projects and monitor their progress. I think we will listen more about this from Art and Elena in the coming moments. This keeps initiatives grounded in real-world barriers and cultures. So the top-down policy is only half the story. So the other half happens on the streets and in the backyards. That's why we recommend direct support for community-driven projects. So the formula is simple: small grants, shared tools, and short practical workshops that can enhance community ideas. Whether that's turning some kind of empty lot into vegetable garden, or lining a school street with shade trees, putting benches, or setting up a bike lane, just whatever. These well-being returns are impressive. A recent study showed that hands-on projects like these can measurably cut the eco-anxiety while bringing neighbors all together. So people feel agency, they see tangible progress, and make new friends in the process. Local governments shouldn't run every plot or program by themselves. Instead, they should partner with the resident associations, youth clubs, and NGOs. So, for example, a city hall can fast-track permits, supply compost or lend a van, or while communities contribute to local knowledge and volunteer physically. So the bottom line is, when local enthusiasm meets the modest but predictable support, sustainable well-being becomes visible, edible, and shareable right where people live. So our final recommendation tackles the supermarket bill. If sustainable food costs more, it remains a lifestyle choice for the few. So that single move makes a healthy, low-carbon plate the cheapest option, especially for families on tight budgets. But affordability isn't just enough. So people also need confidence and motivation. That's where partnership with the urban garden networks and food literacy workshops come in. They teach cooking skills, they build neighborhood connections, and show literally from seed to fork how fresh food fills both the body and the community. So the messaging should put well-being front and at the center. So higher energy, lower risk of diabetes and heart disease, greater life satisfaction. So these campaigns highlight those tangible payoffs, behavior changes faster. And finally, the message should speak to everyone. The sustainable food doesn't just sit on the shelf. People from every income level want to put in their carts. To see how these ideas play out on the ground, so now I will pass my word to colleague Art, and he will show us some policy headlines headlines to real-world stories, showcasing better stories from the communities where have already turned well-being into concrete, inspiring action. Thank you. Please, Art.
Thank you very much, Delay, and thank you to all of you for being here. Um, yeah, like Delay said, I will give a bit of an overview of the better stories that we identified um, for this particular fact sheet and theme, so around well-being and sustainability. And if you are not aware of what a better story is, um, it is a concept that we have borrowed from scholar Dina Georges and her book, The Better Story. It essentially refers to a to a an initiative by civil society or a policy measure that tries to improve or ameliorate a given societal situation without being a perfect or unattainable fix. And so we've identified four of these that are relevant for this fact sheet from among the bottom-up initiatives that we collected in the project. Um, and we've divided these among two general fields that were already discussed by Delay. So I will start off with mobility, where the first better story we found was Walk the City. This is a bottom-up initiative in Prague, and it's run by a women-led ecological association that aims to develop a more walkable Prague. Um, they have been around since the late 80s, or they were known back then as Prague Mothers, and they were really focused, at least in the beginning, um, on the barriers that women face in urban mobility. And over the years, they have gradually expanded their purview to also include other target groups alongside women. Now, their main goals consist of protecting pedestrians by making streets and public spaces safer, um, promoting walking by emphasizing the sustainability and especially health benefits of walking around, especially towards older people and children and their parents who go to school. Um, and to facilitate all this, they try to also improve the existing public spaces in Prague, oftentimes with the assistance of the municipality. And so a concrete example of an activity that they carry out is their collaborations with schools. So they make or they issue challenges, so to speak, to the kids and to their parents to walk to school instead of taking the car, for instance, and experience for themselves that this might be a nicer way to go about things, to commute to school. Um, and they also emphasize the health benefits of doing this. Um, and You can also see when more people, when more parents and children go to school walking, there are also less cars around, which improves safety as well. So this is a small example of what Walk the City does, but I will move on to the second better story that we identified, which is Sindikat Biciclista. This is a cycling NGO based in Croatia, and their overall goal is to improve bicycle-based mobility around the country. Um, this is their main goal, although they also are positively inclined towards other forms of sustainable uh, and possibly healthy mobility, like walking and taking public transport. So these elements also return in their work as well. Um, but what is their work exactly? Well, they engage in policy advocacy, so they meet with local authorities on these issues. They participate in discussions around legislative proposals to, for example, improve cycling infrastructure in cities. They also try to address the general population, so promoting cycling culture among them um, by, yeah, for example, the educational campaigns that they organize as well. These campaigns emphasize, again, the health benefits of cycling, um, but they also try to teach people how to reduce tensions between cyclists on the one hand and pedestrians on the other, as they are oftentimes kind of competing for the same limited public space. So they try to um, preemptively facilitate these conflicts that might arise. And they also emphasize that you can combine cycling with public transport, for instance, taking the bus with your cycle in hand. But then I will move on to the better stories that we have around sustainable and healthy food. There we identified an initiative called Mind Food, which is based in London. The organization that runs this better story organizes opportunities to engage in food growing activities for people struggling with mental health issues. So essentially, they try to make edible gardening more accessible and inclusive while supporting overall well-being and especially mental well-being. So they engage in a form of ecotherapy, really. This can be self-registered, so people can sign themselves up for this, or they can be referred by their GPs, by GPs that might be associated with the project, to these activities. And so their main action really consists of this 6-week long course in edible gardening, where participants gather weekly and engage in activities that reduce their depression, stress, and anxiety symptoms through edible gardening. So growing your own vegetables and fruits for consumption later at home. And as for the impact of these of this course or these courses, Mindfood itself has shared some results. They have noticed, or according to self-reported, according to the reports of the participants, this has led to, among most of them, to improvements in their diet, so more healthier diets, more sustainable diets. And it has also led to improvements in their well-being, both their mental well-being and their physical health because of eating healthier meals. And then finally, I will talk a little bit about Tok en Stok, which is an association based in the Paris region. They organize cooking workshops, which aim to counter food insecurity among the most vulnerable segments of the population. These cooking workshops provide access to healthy food to these people, but they also teach them how to make healthy and sustainable meals on their own, so that they can replicate this outside of the bottom-up initiative as well. And at the end of these activities, they always try to, or they always aim to minimize food waste by recycling anything that's left over. And they try to pass on this practice as well to the people that engage in their workshops. But so who are they actually targeting? They target those specifically living in temporary emergency accommodation, which in practice in this case is mostly women. And it includes refugees, people with very low or no incomes, and survivors of exploitation or trafficking. So to facilitate cooking workshops with these target groups, they also make sure that the recipes they use are adapted to the limited circumstances that these people find themselves in terms of the available cooking equipment or the available ingredients that might be around. So this was a brief overview of the better stories that we think are relevant to the fact sheet and to the recommendations in the fact sheet. And I would like to thank you for listening so far.
Thank you so much, Art, and thank you also, Delay, for the very interesting presentations about the insights of ACCTING project, the results and recommendation, but also the powerful community-led stories that ACCTING has collected and can inspire others. Now, I will pass the floor, and it's my pleasure to introduce to you our guest speaker, which is Dr. Elena Moratopoulou, who is the scientific coordinator at Mamagea. which is, as we said earlier, an environmental organization based in Thessaloniki. Alina brings really a unique perspective at the intersection of education, environmental justice, and participatory action. And today we hope that she will be sharing some insights from the Food for School initiative, but she will also react to the results from the ACCTING fact sheet. Alina, we're very happy to have you with us. The floor is now yours.
Thanks a lot, Vasya, and thank you to the Lion Art for presenting the interesting insights of the fact sheet. And indeed, as we with Mamagea have been part of ACCTING from the, well, not the very beginning of the program, but the beginning of the pilot programs, we do realize that this has been a long journey and that there is a lot of work that has been put into it, definitely. So thank you for the invitation. And for giving me the floor to have a small, as I said in the beginning, I haven't prepared the presentation, but the idea behind it was, like you just said, to have to share some thoughts and maybe even open a conversation and a discussion following up on Arts and Delai's positions on the presentations of the fact sheet. So just taking a step back, which links to what Delai was discussing earlier, Mamagea is a middle out organization. So we often present ourselves as middle out, by which we mean that we try to work at the intersection of what we would call commonly like top down, which is the local authorities in our case, so policies that are made on a higher top level in terms of hierarchical structures, and the bottom-up initiatives, which in our case might be school communities, neighborhood initiatives, etc. So we really try to work at the intersection of the two, which is why we frame our work often as middle out. And we are in constant, and we have sustained relationships with people both from local authorities and the local communities. So this means that we do believe that social transformation indeed kind of requires the mobilization on both ends. And ACCTING, and in particular our pilot on Food for Schools, has been a very indicative example of that. So in Food for Schools, we explored the question of how we can bring more sustainable food to Greek schools, which is an under-researched question and a bit far behind in the Greek agenda, although it's gradually climbing up in the local agenda, at least in Thessaloniki. So there we did some extensive research, and we also did interviews and focus groups and participatory workshops with teachers, with pupils, with school kiosk owners, which are like small food enterprises in Greek schools, with people from the municipality who are responsible for food procurement, etc. Only to find out once again that it's a complex issue in the sense that it does require, like Delai said earlier, the cross-sectoral collaboration in order for change to happen. We also saw in our research, and we highlighted a good example from France, a municipality called Moine-Sartoux, where they have transitioned, I think, completely their food systems to sustainable school food systems by working hand in hand, like the policy working hand in hand with education. So it's indeed a matter of educating people, educating ourselves, and also seeing changes being reflected on the political agenda and political praxis, and vice versa. So we also saw that because when we were designing the outputs of Food for Schools, we did produce an educational toolkit that with the aim to familiarize school communities with sustainable food and what this could look like in the day-to-day school reality. And also we worked with the local authorities and other food stakeholders locally to design a local action plan to change the food procurement in local nursery schools towards more sustainable models. So here again, we see that these things need to go hand in hand. I will not go into detail in terms of what came out from both these works, but they are available online for anyone who wishes to see them on the Mamagea website. I think what we would like also to contribute to this conversation, and what we really emphasized through Food for Schools, was, especially through the toolkit, was to promote a more, I mean, starting from why sustainable food is a good choice. We wanted also to raise awareness on the critical dimensions, let's say, of sustainability. So how sustainable food consumption links to, as Delay said earlier, to how affordable the food is, but also on the bigger scheme of things, the production models on a global level. So we discussed also a lot, for example, with pupils in the classroom, about the to break down the myth of that the planet cannot feed us all, to discuss how the planet can feed everyone if we treat nature with respect without exhausting it. So it's a matter of like questioning things as they are, so not taking them for granted, like things that are beyond our visibility, like the production model of food, and questioning those in parallel to questioning our personal choices, and why some people can make some choices or are more eager to make some choices over others. So that being said, in our work in Mamagea, which is something that we did in Food for Schools, but that we also emphasize and have central in our approach, our methodologies, and our strategy and vision as an organization, is the the relational aspect. So how to relate with the school communities and with every other stakeholder that we work with, but also how to foreground care in the work that we do, and in how the people that we work with relate to one another, care for one another, care for themselves, and care for nature. So this is just to give you an overview of where our strategy and actions center. And that being said, we do indeed engage also with well-being, so conversations on well-being and self-care, and we try, through the example of school vegetable gardens, that we're currently growing a local network of school vegetable gardens, and of schools committed to learning about urban agriculture and sustainable food, and how we can take care of ourselves by eating more, not only healthy, but also sustainable food, and what that means. But we really try to take this as an opportunity to extend self-care from an individual level to a community level, to collectivize, let's say, self-care, so that we avoid reducing it to the habitual and the individual level, which as we also continuously find out, both through reading and researching and by engaging with our communities, is it often risks to shadow or to oversee or even to obscure the structural injustices that lie behind the differences on individuals' take on self-care. So we really try to see through the example of how we can eat more healthily, how we can extend that beyond the individual level. So, and while maintaining the focus on the changes that we need to do also as people and personally, but not to individualize the solutions to the problems. So while being mindful of well-being, to come up with programs that address kind of the root of the structural programs that we see. We had an interesting discussion. Now I'm just picking up an example of the wearables that we can put on to track, let's say, heart rate, or I mean, I have one myself, to be honest. So we had an interesting discussion, though, a bit more of a critical discussion with a classroom the other day, which, yes, it's discussing like what it means to track and ourselves, and what the limits are between self-care and self-optimization to become more productive in our day. So trying to really instill these critical questions and discuss them, and also we understand the amount of data we produce about ourselves and who owes this data afterwards and where this data goes and why this matters, to be conscious of where that goes as well. So we really try to, taking the opportunity of the food system and school vegetable gardens and changing school food systems, we really tried to open up and continue trying to open up the picture to all the interconnected levels that play out. So on a more systemic level, I think that's good for now, and then we can have a conversation if people want to pose some questions. But these were really some reflections that I wanted to make with regards to how useful some of these findings are, but just like bringing to the conversation the element of highlighting a risk of overseeing the systemic dimensions, let's say, that some of these issues might have, and the need and the urgency to continuously bring it up in the conversation. So we hope we've made a contribution in that direction.
Thank you so much, Elena. I will open the floor to the audience in case they have any immediate questions. But it's, of course, up to Art and Dilay in case they want to also react to your inspiring and deeply grounded in practice reflections, I would say. This is something that I was thinking while you were presenting, the fact that you are collectivizing the self-care and the structural changes and the injustices, how they can expand beyond the individual level and not to individualism. This is an important work, and this is an important reflection as well. I would say as a first question, like I was thinking for you and Dilay and Art as well, that how can really institutions but also individuals embed this concept of well-being as a structural driver rather than like a soft add-on, because this is what we normally observe.
So, as I understand your question, Lucia, please correct me if I'm not, if I'm wrong. Just how we can, I mean, for mainly for the top to down kind of institutions you're talking about, yes. So I think this brings us back to our recommendations. That's how we formulated those recommendations. So first comes with defining the indicators and using those indicators for well-being, for integrating the well-being in the policies and development of the policies. But here I want to connect to Elena's comments because I didn't make it, I didn't put much emphasis on it in my discussion. Because it's a well-founded information, not just our findings, that we need to define well-being very well. So well-being is not just about individual fitness or just if you get healthier or what. It has one is physical well-being, of course. This is mainly what we consider when we talk about well-being. But the social well-being is also equally important, and particularly this is important for the vulnerable groups, and this is what we have observed in our just research lines or in our case studies, in our pilots, everywhere. There was a very good discussion in one of the opera studios in the second cycle of this workshops that we have conducted in the ACCTING project about the elderly people. And for example, the cycling trips, even if it adds to their physical well-being, but also the better benefit comes from the social cohesion it creates and then the benefit of it. So when we define there are many well-being indicators which are used. We can find it in the Eurostatistics or everywhere. However, maybe these indicators needs to be studied again a new angle in that perspective to include the community feeling and well-being in it. And this relates to one of our findings as well from the acting. And this finding is it's about how this bottom-up initiatives like the community gardens or this school gardens that Mamagea is creating, for example, it creates of not just for their impact for their diets or anything for healthy diets, but it creates a feeling of being a part of the community. And this is really important for the social well-being. So when integrating these indicators, when defining them, and then working with the society organizations, NGOs, and the bottom-up initiatives supporting them, I think it will be easier to integrate well-being for a better behavior change in a Green Deal perspective.
And also, especially if I might add on to that, when these community initiatives start or are at the level of schools, for instance, or work with children, like from a embedding these values or these practices from a young age, making sure that they're connected to the community, I think is also a very important facilitator for making sure that this is really embedded in a community in the long term.
Thank you, Art and Delight, and thank you, Vasya, for the very poignant question. It's a very big conversation, what you're asking, but I'm trying to ground it and to pick it up from one angle and to ground it on our, again, practice and examples with Mamagea. I think your question, just to rephrase it, was how to embed this more practically, how to embed individual but also collective well-being into the institutions and policy more deeply instead of soft touch interventions, if I understand it correctly. Yes. On a practical and methodological level, I can say that participatory methodologies, which again can be unpacked into so many different things, but methodologies that really reinforce more people's and more diverse opinions, integration and contribution towards a policy in that the example that we're discussing is definitely a cornerstone. So it depends who is going to make this choice about what we're discussing about, to what extent and in what sense well-being will be integrated into policy. And this is about like trying to include many different voices, but also beyond the plurality of it, to actually listen to those people who have something from their lived experience to contribute. So on a methodological level, participatory approaches, however that might translate in practice in different contexts, is definitely key in terms of how to do it. And then also how it can look like, I think it's about making, again, visible the more invisible elements of that sustain our communities and our cities. And for example, the care work that is being put in a school community by the parents, by the teachers, by the pupils themselves, to sustain day-to-day relationships and resilience in their school. These are often unseen forms of care. Or the parent, for example, who had been working for 10 hours last Friday, and they came after their work to the afternoon constructions that we had in a school nearby to build a garden. So these are all kind of undervalued and unrecognized care forms that people, individuals and communities are putting, and they're not valorized and they're not valued and they're not recognized. So definitely shifting the institutional and the policy focus and attention and attentiveness towards these forms of care and really valorizing them in praxis, again, whatever this might mean in different contexts, is a key dimension as well.
Thank you so much for all the responses. Any questions coming from the audience? I don't see any, but yeah, I will monopolize a little bit the questions and answers, because I was thinking while Elena was presenting another question, which is more policy oriented. So based on the work that you have done so far with the Food for Schools initiative and the educational toolkit, I was thinking about the policy level and the municipalities municipality that was involved. Do you feel that at the municipal level, municipalities are ready to move from pilot efforts to more structural reforms that abet this vision? And how is the collaboration with municipalities so far?
That's a question for me, I understand, Vasya. Yeah, picking up from the end of your question, the collaboration is a sustained one and a good one. I would evaluate it as a good one overall. This doesn't mean that there are not difficulties on both sides and constraints and that it's not always smooth and easy. But I would say because also it's a sustained collaboration, like I said, we have been collaborating in different projects over the last few years. This speaks to some extent for itself, that we see something there on both sides. Then in terms of of how committed there are people in a very if we situate where the municipality sits in the grand scheme of things, so more than a decade of cuts and reduced funding and reduced positions in the municipality, and how stretched people are and how many different roles they try to fill in because of the lack of funding. For example, even though we're a very big municipality in the second biggest city of Greece, there is still tremendous lack of funding and investment on the local municipality. So people are really working beyond their capacity for a very extent, and they've been doing that for an extended number of years now. So considering this often shadowed part of the picture, there are still people who are willing to push further and to create some kind of crack or to put an effort to shift something, even if this is like by a tiny bit of change. So we work with these people, or we try to work with these people who are all positioned in key positions, so they have some kind of influence. But again, in the example of, and taking the example of the Food for Schools and the local action plan that we made, we did design a local action plan for how to change, starting from what needs to be done to change the food procurement of local nursery schools. We have like 20-something, 21, 22 nurseries, municipal nurseries in Thessaloniki. It's a manageable scale. So this is something that can be, let's say, the first level of change that can happen. But then there needs to be funding and resources for the local action plan to extend, for people to come and put in place what is being proposed, for conversation and negotiation rounds with local producers and distributors who are part of the food chain. Or there needs to be a 2-year, there's a 2-year interval in the call for tenders, which are open calls to producers who provide the nursery schools with food, and these are open tender calls, which are being relaunched every 2 years. So if we were to make a change, we wouldn't see that being in effect until 2 years down the line. Also, from the discussions with the policymakers and food producers, it's about how you make this sustainable, how you can change the percentage of portion in the tomato, for example, procurement to make it accessible for smaller producers, because the way things are currently established in the framework, small producers cannot afford to give their products to such a scale. So there needs to be, it's really very multi-layered, and there needs to be, of course, political willingness, but also skills and know-how, which we can have, because to some extent we have it internally, or it is around available, and there is a lot of knowledge and good practices available around in Europe already, but also resources and funding for people to fill out places and positions that are key for this to move forward. And of course, education to go hand in hand with whatever change is being attempted. Yeah.
Thank you so much. This touched so many levels of effort that are required for policy action. Art and Delay, I'll leave you, if you, in case you want to react to what Elina was saying.
Well, yeah, from the better stories that we included in the fact sheet, we also see that, yeah, funding is definitely an important aspect, and how to have that continuous funding. We see that some are working with a more bottom-up approach, really, where they're really propelled by, let's say, individual donations or donations from the community, whereas others lean more towards municipalities for their funding. But I mean, it seems to be a struggle for all of them, for sure. Yeah.
Delay, so that you have unmuted yourself.
Yes, yeah, because also I was trying to think also meanwhile how to put it in words, because I mean with Elina's pilot study we had a very interesting insight. First about, well, just she didn't mention about it, but the intricacy of the policy structures, and it created a really big hurdle for our pilot to get realized, to go through all these formalities and everything. However, what was really interesting for me to see in that pilot is that just we are talking about the vulnerable groups, for example, like maybe just elderly, disabled, very well suspected. However, there may be some hidden vulnerabilities just we have observed in the pilots, and particularly when we're talking about well-being, we're talking about, for example, some psychological disorders. For example, in terms of well-being, eating disorders is becoming a big concern among the pupils, students, and the young generations. And this may be not really obvious in the society. And we are aiming at those kind of interventions. We need to be careful about how to include those groups into the intervention, and also how to maybe I'm sorry, just my mind is gone. Maybe how to include those people and also react according to their well-being. Just maybe a more interdisciplinary research also here is required, as we tried in the ACCTING, like including psychologists, policymakers, decision makers, all together in just going in the future in those directions. Elina might have maybe better examples on that, what they have observed during the pilot.
Yeah, thank you, Delay. That's a good point. I think we've reported about that in the report. To give again a tangible example, we undermined ourselves the time. I mean, I think we did quite a lot as part of the Food for Schools in a very limited time, but still or as a result of which we undermined this aspect, for example, that you just said. So when we run the workshop So we ran a creative workshop with students from different primary schools in the city that we have collaboration with, to start a conversation about their food habits and the food chain and what changes they wish to see in their food supply chain in their school, etc. So there we figured it became more obvious to us something that we were literally not well informed about, is the honest answer, which was that a couple of kids, but still they were they felt uncomfortable sharing what they eat, and or they felt ashamed because their families didn't buy healthy food for lunch, or they wouldn't cook for them, or they wouldn't eat together, which again we see that the root causes for why this happens are of course not obvious in a circle of kids discussing what they eat, but the child knows for themselves that there is a social stigma because of, for example, the financial situation of their parents, and what they can or cannot eat, or there were kids that were like, because of their bodily appearance, they would feel that they need to become fitter, and they would become obsessed with. There was this kid that he would become obsessed with, exercising, and he was feeling ashamed for discussing what he eats. And this shows, and we know, I don't remember the numbers now, but we had looked into them about how like food related let's say disorders, I'm not sure if that's the right word to use here, but like how they have increased among youth, which again it's an outcome of and a consequence of many other aspects that are influencing a young person's life and their family's life, from social pressure to different things, to financial situation, to a number of different reasons. So yeah, we need to really put attention and into how we approach this, and how we do not pathologize the child, the young person, or their family. Because when we saw that in a conversation with a policymaker, when they said that, and that was in the early stages, that we had a circle of discussions where he said that they have made in their municipality an attempt to bring a food psychologist and a nutritionist and do this, and they taught the children what they should be eating, but yet here they go and take the croissant from their parents' hands in the break when they come to bring them food. And he was I don't think he was doing it intentionally, but in his head, from his understanding, it was the child's and the family's blame, that the child wouldn't understand why it's good for their health not to eat the croissant, but to eat as a fruit, for example, in the break. But it's not the child's fault, or it's not the family's fault. It's a more systemic. Of course, their food education can change, but it's one of the pillars that need changing for them to change how they eat. Yeah.
Yeah, thank you so much, everyone. I think even though the discussion is really interesting so far, that we need also to wrap up. So finally, I'd like to ask each one of you, if you had to select one concrete shift, whether it's in mindset or practice or policy, that you believe is essential if we want well-being to genuinely drive sustainable change in our communities, what would that be? One shift that you can think of. I understand that this is a difficult question. There's not always one solution to a problem, but as a key takeaway.
Yeah, that's a difficult question. Even though I need to think a little bit, but yeah, let me just think. How we started actually, just with this idea over the course of 3 years, and we ended up here, that there's a big shift in the people's understanding of behavior, and we see a big kind of a trend towards well-being. in the young generation, as Elena just said. They are, sometimes it may be about their physical appearance or just being healthy, whatever. I mean, in all generations, it's more, people are more concerned compared to our parents. We are more concerned, and our kids will be more concerned about it. And maybe just I would put again the easiest one in the front, that it is the using the communication and information exchange. I think I would put in the first priority, because it is the least costly. It doesn't require just too much intervention in the policy mechanisms, which is very difficult to intervene. And just maybe it is one of the most effective ways, because well, you see this young generation, they're mainly going after the social media influencers, whatever. Maybe using some techniques of effective communication would be my first priority in this matter.
Thanks, Delay. Indeed, using communication, I would say, is key. Also, because indeed, past generations might not be that aware as we are today about those topics. And also, as you said, influencers, if they're using their platforms for good, then a real shift could happen. Art?
Yeah, maybe picking up on what Alina was saying before. Yeah, just when going for this connection between sustainability and well-being, making sure that there's no that no stigmatization happens, right? That these processes are as inclusive as possible, that they do not stigmatize families for not being able to afford bicycles for their children, for example, or to afford healthier foods and stuff like that. I think that's a key element that should always be taken into account.
Thank you, Art. No stigma. Very important, and more inclusivity, as if it's possible and when it's possible, of course. So with that, Alina, you will be the one with your closing thought.
It's indeed a big question that you posed. So trying to do some justice to it, I would say maybe taking a step back, but I think it's important, like to redefine what matters and what shifts, because you said what shift needs to be made, and I think it's a shift in terms of like prioritizing what matters, because to a large, what we witness now is that I mean, financial profit and development is framed and understood in a very particular way that still leads the courage, and every other attempt for sustainability comes as patchwork instead of a priority. So social and environmental and ecological justice and their interstices are not there as the lead they try to follow. So this really needs to shift and yeah, this takes the conversation a step behind, but I think it's fundamental. So yeah, I mean, financial profit should no longer, and we cannot afford that anyways in the longer run, given how the environment is, the physical environment, but also the social environment. We see the consequences of the mass extraction, mass production of food, etc. So this really shows the shift in the priority. And also in terms of like on if you want to take it on a European level and on a European policy level, and with having the European Green Deal as our case study, again, how can we develop criteria to evaluate the such reforms and the changes that they wish to bring, by drawing, for example, on social movements for socio-ecological justice across the world that we see a rise in, like people knowing for themselves and for their lands what is for the best. So how can we develop also criteria that that draw on their learnings and on their movements for socio-ecological justice. And this, of course, extends from the global north, where we are, to the global south as well, because the food chain in particular that we're discussing now, but the environment overall and us as society, we're interconnected. So it's a matter of understanding, you know, what justice looks like across the globe.
Thank you so much, everyone, and Alina. Like, linking all that you say, I would say, like, it's central to prioritize what matters, which is not financial profit. It's not the development as it is right now, but it's more about social and environmental justice should be at the center of what we need to shift in the paradigm. Also with no stigma, and using communication and our platforms for good. So thank you so much. I think what we've heard remind us that well-being isn't only about feeling good. It's about creating these social and environmental conditions for people to do good and feel good overall. So thank you so much to Elina, Delay Art, and everyone that joined us for attending today. You will receive a follow-up email with the link to the recording and any resources, also the fact sheet and the Food for Schools toolkit, which is available online. And on behalf of the ACCTING team, thank you once again, and we hope to see you at one of our upcoming webinars. Have a nice afternoon.
Thank you very much.
Thank you very much.
Thank you.
Bye.
Bye.